Okay, guys, so joining us also tonight, we have, of course, our President, Sir Leon Katz, and also we have our medical consultant, Dr. Arlie Imperio, and I see also Dr. Denise in tonight's call. Okay, so without further ado, I'd like to pass this now to Dr. Mario.
Thank you, everyone. Thank you, Francis. I'd like to begin on that is very dear to my mind and to my heart about the problems of osteoporosis. And I would like to shed some knowledge information for you guys, particularly women, because the incidence of osteoporosis is bigger in women compared to men. And we shall explain that later. But before we start and find out, we have to understand what osteoporosis is. Okay? Start with this short video.
Did you know that your bones are made of living tissue that is always growing and changing? Cortical bone, the hard outer shell of your bones, covers the spongy, softer inner core called trabecular bone. This combination of bone tissue allows your bones to protect your organs without breaking while absorbing impact caused by your movements. Your bones are constantly being broken down and rebuilt. Cells called osteoclasts remove old bone tissue in a process called resorption. Cells called osteoblasts deposit calcium and minerals into your bones to build new tissue to help your bones grow and stay strong. This is called deposition. In healthy bones, reabsorption and deposition occur at mostly the same rate. In some cases, resorption occurs faster than deposition, leading to loss of mass and causing bones to grow thinner, weaker, and more likely to break, a condition called osteoporosis. Anyone can get osteoporosis, but women are more likely to get it than men. Aging, having a small body and bones, and a family history of osteoporosis are also risk factors. Causes of osteoporosis include a low calcium diet, alcohol abuse, and not getting enough physical activity. You can help prevent osteoporosis by eating a healthy diet of calcium-rich foods like milk, yogurt, and leafy green vegetables, drinking alcohol in moderation, not smoking, and doing regular strength training or weight-bearing physical activity. Have questions? Ask your doctor what you can do to prevent bone loss today.
So it's important to understand that weight training is important. And osteoporosis comes from the Latin word that means osteo, meaning bone, and poros, meaning porous bone. So it's a porous bone or a brittle bone disease. And as you can see from the picture on the right, the normal bone, you can see trabecular bone, and well packed. While in osteoporotic bone, there are a lot of vacuoles, empty spaces that makes the the bone brittle, and it is this spaces that causes um, problems on potential problems, particularly for those women who are under age group that could cause more osteoporotic problems and fractures. So let's start with physiology of the bone. How does the body build bone?
Osteoporosis is when your bones deteriorate, putting you more at risk for fractures. Your bones protect your internal organs, store minerals your body needs, and give your body structure. Your bones are alive, and in order to stay healthy, they need calcium, protein, phosphorus, magnesium, and vitamins A and D. Your bones take most of these vitamins and minerals from what you eat and drink. Your bones are constantly being repaired and reconstructed, and new bone is always being formed. Cells, called osteoclasts, dissolve your damaged bone, leaving tiny holes. Once the damaged bone is removed, cells called osteoblasts take calcium from your bloodstream and fill the holes with new, healthy bone. Osteoclasts and osteoblasts need hormones in order to work properly. If they can't get enough of the hormones they need, they aren't able to repair and rebuild your bones. This is one of the main causes of osteoporosis. Other causes of osteoporosis are not getting enough vitamins and minerals, poor eating habits, and not getting enough exercise. If you think you could be at risk for osteoporosis, talk to your doctor.
Thank you, Debbie, for the introduction on osteoporosis. And again, here comes the balance, and you have to understand this chart. There should be a balance between bone resorption and bone formation, and everything stems on the mesenchymal cells, stem cells, and the hematopoietic stem cells. These are two different stem cell lines. One is the one responsible for bone resorption, and the other one is bone formation. So the mesenchymal cell line are the one responsible for the blast cells, while the hematopoietic cell line are for the osteoclast cells, the ones that removes calcium in the body. The osteoblasts are the ones that provides and lines the bone with calcium. So these are two different cell lines, and all comes from stem cells. And you have to understand that the stem cells may be encouraged to produce more osteocytes or more osteoblasts, depending on the balance that is needed by the body. There should be a balance between bone resorption and bone formation, and I hope that it's clear. And the osteoblast, once it becomes incorporated, is filled with calcium, then they become incorporated in the bone and they become the osteocytes. So in the bone matrix, the osteoblast becomes the osteocyte. So bone density, therefore, is a balance between bone resorption and bone formation. So if the bone resorption is greater than the bone formation, then you have osteoporosis. If the bone formation is greater than bone resorption, you have heterotrophic ossification, or osteopetrosis is actually an increase in the bone deposition in the body. So in osteoporosis, for example, there is an imbalance between bone resorption leading to bone loss and structural decay of the skeleton. There is such a thing as what we call an osteopenia, which is something midway between osteoporosis and normal bone density. So it's not as severe as osteoporosis. Osteopenia is a little less than osteoporosis, and bone density is below normal, but it's not as severe as and life threatening as osteoporosis. So osteopenia. And again, you can see for healthy bone, there is a balance of the blast cells because the osteoclast removes bone, the osteoblast deposits bone. But as we grow old and calcium is needed more and more and more in the body, particularly in women, because women are childbearing, meaning they get pregnant. So the more they get pregnancy that they have, the more prone for them to have osteoporosis. So the osteoclasts are the ones that provides and removes calcium from the bone so that it could supply the circulation with calcium and provide calcium to the baby if that mother is pregnant. That is how the class does it and provides the needed calcium for the baby. And the blast should be able to provide or put calcium back. But unfortunately, because of the demand is imbalanced and you're not getting enough calcium in your diet and you're not getting enough exercise, and because of an hormonal imbalance, perhaps what is happening is that you're not depositing calcium. The class is still doing the osteoclasts are still doing its job. The blasts are not doing its job, so you end up with an osteoporotic bone. So the pathophysiology is that because of problems with the hormones, because of problems with nutrition, particularly estrogen in female, the lack of exercise, the sedentary lifestyle, your bone mass is affected, bone strength is affected, the architecture and geometry of the bone is affected, and the materials that are used for lining and strengthening the bone, particularly calcium, is affected. So bone strength is affected, and because of aging you get more problems with balance. And when aged people or older people fall, they get fractures. And when they get fractures, they come to me. And when they come to me, I operate on them and replace most frequently their hip joints, because when they fall on their bottoms. Okay, so the most common sites of osteoporosis for you to understand is that it is known to be a brittle disease or fragile bone which breaks. And it is a silent, as I have said, it is a silent disease. You do not know that you have osteoporosis until such a time as you have a fracture or a bone break. And that is a problem, because a lot of things that is happening right now, and a lot of my patients said that, oh, I was okay until finally a few days ago I fell on my buttocks and hurt my hips or hurt my hands. So the most common sites for osteoporosis are the spine, the hip, the wrist, and these are the three most common problems. And spine osteoporosis can cause severe deformity and pain in the back, as well as neurologic deformity, such as weakness. So here you can see this is the normal height of a spine, but once you fall, it gets compressed. And see that height from this white level to this white level, it gets compressed. And that is a compression fracture of the spine. What will happen is that when this compression fracture becomes more severe and more severe, we will have a hump back. I will be explaining it further a little bit later on. And the risk, I get a lot of this, is that when patients with osteoporosis fall, they try to break their fall with their wrist. And what happens is that they don't get a spinal fracture, but they do get a wrist fracture. And this is very common. Both spinal fracture and the lumbar and thoracic vertebra are very common in the elderly. There is also a lot of problems. If you can see this slide, this is the normal femoral neck. All right, it is your hip joint. It's ball and socket here. There's the femoral neck, which connects from the hip joint, connected to the femur. And what happens is that this is the area that is very prone to fractures, as you can see here on the other side, on the right, basically the left, the patient. You can see a femoral neck fracture here. This is the fracture. And on the humerus, which is your shoulder bone, you can see a humeral neck fracture. And these are the fractures that occurs when you fall on your shoulder, which is very uncommon. The most common is still falling on your buttock. So spine, the femoral neck, and wrist are the most common fracture sites. But there are uncommon fracture sites. I have patients who develop a rib fracture only after a very bad sneeze. She just sneezed and she had a rib fracture. Fortunately, for single rib fracture, we do not do anything about it. Just observe and give hot compress and medicate. So the risk factors for osteoporosis are alcohol use. I mean, alcohol abuse, drinking a lot of alcohol, not the rubbing alcohol you put in your hands, okay? The alcohol you put in your mouth. Corticosteroid use. I have had a lot of patients who abuse corticosteroids because they said that, oh, I'm thin, I want to gain weight. This is what my neighbor said. If I take this corticosteroid, prednisone, that I will gain weight. And they do take the corticosteroid, but they do have moon phases. That's all water. And they do gain weight, but it's all water. Once they pee it, they stop the corticosteroid use. And it causes osteopenia, then later osteoporosis. Low calcium, we'll be talking about that later, about the diet and how your diet affects the calcium and your lifestyle affects the calcium. Low estrogen in women who are menopausic, those who have undergone a stage of menopause with low estrogen can cause problems with the bone. Smoking, of course, and a sedentary lifestyle. So it's access can lead to osteoporosis. The mnemonic access leads to we will be talking here for the secondary causes, but basically the risk factors are if you are women over the age of 70 years old with a previous history of fracture after the age of 40, maternal history of fracture after the age of 50, low body mass index, low calcium intake, they're not taking any calcium rich food, postural instability, again that's the most common. If you lack balance and there is some postural instability and weakness, particularly in the quadriceps, the muscles in front of your legs, here on your thighs, a history of fall during the past 12 months. If you are Caucasian, there are higher incidence of fractures, cigarette smoking, poor visual acuity for those with the problems with sight. But the secondary cause, okay, you have to understand that these are also one of the uses or the most problematic. The use of corticosteroids, as I have mentioned earlier, um, alcoholism, problems, genetic problems like hypogonadism, anticonvulsant to use immobilization. So, for example, the patient have fractured and immobilized. There is such a thing as um, immobilization osteoporosis. Because of this use osteoporosis, the less you use your body, the more brittle it becomes. Rheumatoid arthritis because of the pain, chronic obstructive pulmonary diseases because of the limitation of physical activity, inflammatory bowel disease because of the ability of the gut to absorb calcium, hypercalcinuria, which is the excretion of calcium in your urine, severe renal and liver failure because the kidneys and the liver provide the needed hormones as well as the proteins and enzymes needed to produce osteoblasts and osteoclasts. And again, organ transplantation, because usually those who have had organ transplantation are taking glucocorticosteroids. So the diagnosis basically is physical examination. And there is such a thing that with bone densitometer, an X-ray absorptionometry, DXA, or a bone densitometer reading. Ultrasound is a useful and easy and cheap way of measuring bone. Ultrasound of your wrist, basically. CT scan for more severe problems, particularly if there is a problem with the fracture and a neurologic problem pertaining to the back or the spine. Radiography or X-ray is tantamount to diagnostic. You will see that and you will see osteoporotic changes, but the more quantitative is the bone DXA or the bone density studies. You can also see some kyphosis, which is a spinal disorder, which is extreme curvature of the spine resulting to a rounded back. So it's like a humpback already. And there is also some problems called the dowager's hump, which is the forward bending of the upper spine. So it's a permanent hump, but this occurs not only in osteoporosis, but also in postural problems. So treatment, again, let me briefly tell you what to do. One, these are the ways to treat osteoporosis. Number one, we medicate. We will discuss that more later. We give the supplements, particularly the calcium, sun exposure to sunlight. Okay, women who are particularly immobile or bedridden should be brought out to the sun every morning for them to be exposed to the sun and do some exercises if they can. For those who cannot, it is imperative to do some bracing, particularly in the lower back, because these are the most common problems that occurs and causes lower back fractures. Diet, imperative that we change the diet, and we will be discussing more about the diet later. And exercise, and I'll be showing you more exercises, weight-bearing exercises in particular, and I shall explain later why weight bearing is important for you guys with osteoporosis. So, how do we prevent osteoporosis? You have to eat a bone healthy diet, weight bearing exercise, quit smoking, get enough sleep, and limit alcohol intake. So, prevention of osteoporosis. Okay, you have to understand that osteoporosis starts early. Your problem with osteoporosis starts early because imagine that your bone is a bank and calcium is its currency, okay? So your bone deposits calcium. It is where the currency of the body for your bone is being deposited. So your bone accepts calcium as its currency, and early in our age, we deposit calcium aggressively in our bone. So during the early age, particularly in children and adolescents, we are able to deposit more and more and more and more calcium on our in our bones. But as we age, that ability to deposit calcium in our bones becomes slower and slower and slower and slower, slower until it disappears, until we are unable to deposit calcium in the bone, and that happens, osteoporosis develops. Then we reach old age, and our chances of us developing osteoporosis depends on how much deposit we have of calcium in our bone bank. Sounds familiar, right? Just like the currency of money. As we age, we withdraw and withdraw money from our bank because we have to get money to take care of our health. As we age, we get more and more calcium from our bone, which is needed for the body for to do its natural function, because calcium is essential for the natural function of the other systems of the body. So, prevention is to prevent the risk factors, like if you are premenopausal, you have to undergo some possible hormone therapy and do aggressive exercises. You have to medicate your old age. You're medicating with glucocorticosteroids. You have an endocrine problem. You have a rheumatoid arthritis, which is an inflammatory arthropathy. You have a hematopoietic problem where your bone is unable to make more of the hematopoietic cells. You have nutritional disorder where you cannot absorb calcium. And what happens is that your bone density disappears. There's a imbalance between bone remodeling. There's an increase in bone resorption. There is an increased risk of bone fracture. And this determines the quality of your life and the age expectancy of patients. Now, let's go on nutrition. And I have to stress that these are been researches that are being done right now with regards to nutrition. Beans, although some beans contain calcium, magnesium, and fiber, beans to interfere with the body's ability to absorb calcium because of phytates. The phytates in the beans absorb or interferes with the ability to absorb calcium in the body. So you can reduce the phytate level by soaking your beans in water for several hours before cooking them. Again, soak your beans in water before cooking them to decrease the possibility or decrease the level of phytates in your body. You understand? All right. So we continue. Next is that meat and other high proteins. So it is important you get enough meat, you get enough protein, but not too much, because too much protein again interferes with calcium absorption in the body, and the body loses more calcium. And this loss is actually tantamount to you getting eating more and more proteins and losing more calcium in the body. So not enough, just a balance of protein. And one of the most common and most effective product to use, you drink a lot of yogurt. I like yogurt. It has a lot of proteins and calcium in it. So salty food, if you are too salty in your food, causes loss the body to lose calcium, particularly for processed food, canned food, adding salt to your food. So if it is listed to be more than 20% or more than the recommended daily dose of calcium, it is too high in calcium. So the food that you're eating, you look at the nutritional fact at the back. If it has more than 2,300 milligrams of calcium, you have to decrease that because your body only requires no more than 2,300 milligrams of calcium per day. All right. So check on the label, check on the nutritional facts. Be sure that you're not getting an excess of 2,300 milligrams of calcium. So, spinach. Oh, wow. The mentality of spinach and Popeye the sailor, Popeye right now has osteoporosis because he takes a lot of spinach, because spinach has oxalates or oxalic acid, which interferes again with calcium. And other food that has rich in oxalates are the rhubarbs, the beet greens, and certain beans. So try to avoid taking too much of the spinach. And if you're taking the spinach, avoid taking it with calcium because your calcium will not get absorbed because of the oxalates, right? Because calcium will bind to the oxalic acid and it will produce calcium oxalates, which will be excreted in the stool. So right now, Popeye has osteoporosis because of the humpback, because of eating too much spinach. Again, wheat bran kind of bread, which contains high level of phytates again, which interferes with calcium. Unlike beans, now 100% wheat bran is the only food that reduces the absorption of calcium and other foods eaten at the same time. So when you eat wheat bran, it interferes with the absorption of calcium immediately when you take it. So for example, when you have milk and 100% wheat bran together, cereal wheat bran together, you take it together, your body can absorb some, but not all of the calcium in the milk. Then the wheat bran in the other food like bread, other kinds of breads are much less concentrated and most likely to have noticeable impact in calcium. They will not affect calcium absorption. So bread is okay. If you take calcium supplements, you may want to take the two of them a few hours before or after eating 100% wheat bread. Understood? Okay, let's go on. Again, nutrition and osteoporosis, alcoholic, heavy alcoholic drinking can lead to bone loss. So limit your alcohol to no more than 2 to 3 shots of alcohols per day, not bottles, okay? 2 to 3 shots, glasses of alcohols. Caffeine, if you're a heavy caffeine drinker, because coffee, tea, and soft drinks, particularly sodas, contains caffeine, which decreases calcium absorption. We will be discussing more on the soda drinks later on and contribute to osteoporosis. Coffee and tea, because again of the caffeine interferes with the absorption of calcium and causes bone loss. So not too much of the coffee and tea. Maybe 3 cups of coffee and tea per day. Again, limit coffee, limit soda. Soft drinks will do more on the soft drinks because some studies suggest that colas, but not other soft drinks, okay? Colas, to some are more prominent, particularly the colas, and are associated with bone loss. While research says that the link may be because the soft drinks, we're taking more soft drinks and less milk, less calcium rich beverages. And what happens is that because of the imbalance, you're taking more carbonated soft drinks. It causes more harm to the body and less of the calcium rich beverages that could contribute and contribute calcium into the body. Plus the caffeine from soda and the phosphorus, and we'll be talking about the competitive inhibitor of phosphorus and calcium later on, contribute also to bone loss. So like calcium, phosphorus is a part of the bone. So it is an ingredient of some other colas, and processed food are high in phosphates and high in phosphoric acid. So to harm the bone, actually, according to the American Society for Osteoporosis, to the harm to the bone actually can cause because people choose to drink, again, as I mentioned earlier, a lot more sodas compared to drinking a calcium rich beverage. So to help make up, if you take a lot of the sodas, you have to take calcium to meet your calcium's daily requirement. Here we go on to exercises, and I have to stress exercises is important for you guys and every one of you, because God had not made us to be sedentary. He made our joints to be mobile, so we have to use those joints and avoid being sedentary. Because of the advent of technology, we are all getting to be more sedentary. Like, we don't go like before. They used to be some rotary televisions. You go to the television to change the channel. Now, the only time you go to the television is when you look for or you get your remote control, and that's it. Then you sit in your chair, in your lounge massage chair, watch television for hours, and you fall asleep in watching television. Those sedentary lifestyles causes more and more problems and more osteoporotic problems as we age. And let me explain to you this Wolff's law. According to Julius Wolff, every change in form and function of bone, particularly in function alone, is followed by certain definitive changes in their internal architecture of the bone and the secondary alteration in the external configuration of the bone according to mathematical laws. Or, healthy bone will adapt to the load under which it is placed. So if you are placing a healthy bone under more load, the stronger that bone is going to be. Plain and simple. Because according to Wolff's law, the more stress you put on that bone, the stronger that bone is going to be. That's imperative again, as I tell you that exercise is important to prevent fractures. So, from fit to fall or fractures, you should be doing some strength exercises, strength training, push ups, sit ups, and you should do some balancing exercises, dancing, Tai Chi. I will be explaining Tai Chi a little bit later on. Postural awareness. Sometimes we are doing this, we're slouching. Physical aerobic exercises like Zumba, about 150 minutes of aerobic exercises per week that is needed. Exercises, weight bearing exercises. Again, this is important. You have to do some muscle trainings, weight bearing exercises. So, forward, these are the weight bearing exercises that elderly I recommend should be doing with support, with guidance, because particularly if they are prone to falls, you have to understand that they have to be guided when doing the exercises. So I want you to look at this. This is about Tai Chi, and I am a strong believer of Tai Chi, and I will explain later on why you guys need to be doing Tai Chi.
And health. This program can bring you better quality of life and reduce the risk of falls. Dr. Paul Lamb, a family physician in Sydney, Australia, is a world leader in the field of Tai Chi for health improvement. Dr. Lamb and a team of medical and Tai Chi experts have created this program especially for older people and people with osteoporosis.
Osteoporosis Australia supports this Tai Chi for Osteoporosis program developed by Dr. Paul Lamb. Tai Chi, for instance, is a fabulous exercise for all older adults to undertake because it fulfills many of the outcomes that we wish to achieve with exercise programs with the elderly.
Hello and welcome. I'm Paul Lamb. Exercise is essential for health, especially so for people with osteoporosis. It is very important for you to choose a suitable and safe exercise. Let me show you the movement.
Form 1, Commencement Form.
When you start standing upright, imagine your body is a string that you gently stretch it, not tense. Your body upright like a straight line, and tuck your chin in gently. Leave a small space in your armpit and focus.
Kindly observe the movements, and I will be explaining this a little bit later on. Okay, as you can see from the exercise, you can see that Tai Chi is one of the best exercise. Number one, for balance, because one of the things Tai Chi experts, Dr. Paul Lam, is saying that you have to have initially a good balance, and you develop more balance the more exercise that you do. As I was telling you, you have to observe the movements, because the range of motion exercises that you can see from this exercise from Tai Chi, it increases the range of motion of your shoulders, your knees, your back, everything in the body. And it is essential to understand that the more you move, the better your joint is going to be, because most of the joint does not have a blood supply. What it has is that it is actually fed by movement. So it's a mechanical movement that increases the nutrition of the joints itself. So let's go now on osteoporosis and soda. Phosphoric acid, which is the major component of soda, is a competitive inhibitor for calcium. The more phosphoric acid or phosphorus in itself, which is a major joint, a major component also of your bone, the less calcium that you have in the body. So if your phosphorus diet is too high in terms of the phosphoric acid, you drink a lot of sodas, calcium excretion will be higher and bone loss will be greater. And the other component that is bad for you in sodas is the caffeine. Caffeine also interferes with soda, with the calcium absorption. But as you can see, there are non-caffeinated colas, which lower and is associated with low bone density. All right. So you drink less caffeinated colas, sodas, to lessen the possibility of you getting osteoporosis. All right. So again, this is important because you have to understand that there's a balance between the blast and the osteoclast. And this will explain everything.
Bone is a dynamic tissue that is continually being built, broken down, and rebuilt in a process called bone remodeling. Bone tissue is broken down and resorbed by multinucleated cells known as osteoclasts. These cells are derived from monocytes, which originate within bone marrow. Osteoclasts play an important role in liberating minerals and other molecules stored within the bone matrix. Bone tissue serves as a repository for vital minerals, including calcium phosphate and various biologically active molecules, such as growth factors. The release of calcium from the bone can play a role in maintaining its homeostasis within the body. The cells responsible for building new bone tissue are known as osteoblasts. Osteoblasts are thought to be derived from cells found to be associated with blood vessels. Once active, they start to produce the organic component of bone, osteoid, which is predominantly made of collagen. Minerals start to crystallize around the collagen scaffold to form hydroxyapatite, the major inorganic constituent of bone, which contains calcium phosphate. Bone mineral density, or BMD, can be used to estimate the strength of bone and to assess the risk of fracture. As osteoblasts form new bone tissue, many become embedded within the matrix and differentiate into osteocytes. The structure, composition, and cellular processes that occur within bone allow it to simultaneously serve as a calcium reservoir, while providing structural support for the vital organs and for locomotion.
So this summarizes the balance between the osteoclast and the osteoblast. And I have to stress how important it is for you to understand the balance between these two systems. So again, you can see from stem cells, there is the hematopoietic and the mesenchymal stem cells. They produce osteoblasts and they produce the osteoclasts. And this balance between bone formation and bone destruction maintains an homeostasis in the bone turnover. Too much formation causes heterotropic ossification or osteopetrosis. Too much bone destruction causes osteoporosis. So the balance is again important because too much of the clast and less of the blast would lead to osteoporosis, a decrease which has a smaller number of trabecular systems, lesser thickness of the trabecular, increase trabecular spacing, and increases expansion of the bone marrow cavity and increased risk of fractures. So as you can see here, that balance is increased. The bone density by decreasing. There should be a balance between bone formation and resorption, and that balance, as you can see from the bone, if this organ is the bone, the tissue, the cell, the nutrients that provides the balance between the clastic activity and the blastic activity of the bone are called nucleotide. Thank you very much.